Hello, this is Dr. Ma. Today we're going to talk about carpal tunnel syndrome. Now, if you have numbness and tingling in your fingers and hands, or even weakness, but not in the pinky finger, you might have carpal tunnel syndrome. Carpal tunnel syndrome is caused by performing repetitive movements such as typing or playing instrument, or performing repetitive occupations such as being a hairdresser or mechanic. Now, carpal tunnel syndrome can also be caused by direct fall to the wrist, or trauma to the wrist, or car accident, or even some medical conditions such as diabetes, which actually increases inflammation in the nerves. Now, when carpal tunnel syndrome becomes severe and is left untreated, it could lead to loss of hand function or even permanent nerve damage. So it could be actually pretty serious. Today, we're going to talk about some carpal tunnel stretches that you could do at home. And you just need to follow along with the video and repeat these stretches 2 to 3 times a day. But at any point you feel sharp pain or increased symptoms, you should stop doing these stretches right away, because symptoms are the way of your body telling you that something is wrong. And if you do suspect that your carpal tunnel syndrome is very severe, you should consult with a doctor and make sure that the stretches are safe for you to do. Okay, let's get started.
Now, while you do these stretches, you start getting numbness and tingling in the hands and arm. That means you either did them too long or too hard. So you should stop doing that hard or that long. And if you get into the starting position of the stretch and you start feeling numbness, tingling right away, that means that stretch is actually not right for you. So you should definitely consult with a physician to make sure that these stretches are right for you before you start. Now, we're gonna have Erica here demonstrate the stretches for you, and we're gonna go 10 seconds at a time and repeat 3 times. So you could just follow along with the video, but eventually you will need to increase the stretches to up to 30 seconds per stretch. Okay, let's get started. First, we're going to start with a wrist flexion and extension stretch. We raise the arm first straight and bring the hand backwards. Take the other hand over and gently stretch the fingers backward. We're gonna count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we're gonna bend the hand downwards. And then take our fingers and grab on top of the hand and then pull it backwards slightly. Count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We're gonna look at the stretch from the side. So raise the arm up, bend the wrist backwards, and we pull. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we're gonna drop the hand down and then grab the top of the hand and pull backwards again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, we're gonna stretch out the other arm in case you wanted to know how the other arm looks. Arm up, grab the top of the hand, pull backwards. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we put the hand down, grab the back of the hand, and pull backwards. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we're going to do a prayer stretch. This is a little bit more aggressive than the first one. Now first, we're gonna put our hands together, just like we're praying, and keep the hands straight up, and we're gonna put the hand close to our chest, elbows out, and then we're gonna gently push down until we feel a little gentle pressure on the wrist. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now the prayer stretch on the side view. We're gonna put our hands together again, elbows out, and we're gonna go down straight. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now at a different angle, gonna put our hands together again, put it close to our chest and bring it down a little bit. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we're going to do a thumb stretch. We're gonna put our hand straight forward, bring the palm up, and put the hand backwards. Reach below our hand, grab onto the thumb, and pull backwards gently. And you have to do it gently. You could easily sprain your thumb doing this. If you do it too hard, we're gonna count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, we're gonna see the thumb stretch at a different angle. We're gonna bring the arm up straight, turn the hand over to the ceiling, bring the hand backwards, and reach over and grab the thumb and pull backwards slightly. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The thumb stretch at a different angle yet again. Bring the arm straight up, turn the hand over, wrist extended all the way, grab the thumb backwards, and we're gonna pull. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we're going to go over the nerve flossing for the median nerve. This is a little bit more complicated than the other stretches. Okay, we're gonna bring the arm up all the way, and then palm up. Now we're gonna bring the hand to our shoulder, and then we're gonna bend our head away from the arm. This is the starting position, and then we're going to repeat this motion 10 times. Okay, look what Erica does. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now the nerve flossing is very tiring stretch, so if the 10 times was too hard on you, then you should not have to repeat this one again. Okay, but if you're tough, then here we go. Arm up, all the way to our shoulder. Now 1, 2, 3, 4, 5, 6, 7, 8, 9, and final one, 10. Okay, the last set, arm straight up, palm down, head bend, and then arm all the way to the shoulder. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, the last one, 10. Now we're going to do a nerve stretch. This is very aggressive, so if you start feeling numbness and tingling while you do this, please stop. And here we go. Now we're gonna rotate the hand all the way backwards, bring the wrist backwards, bring the entire arm backwards. We're gonna bend the head away from the shoulder, and then we're gonna bring the shoulder up. That's a shoulder shrug, and now here we go. Down, 1, down, 2, down, 3, down, 4, down, 5, down, 6, down, 7, down, 8, down, 9, down, 10, down. Okay, the shoulder shrug stretch at a different angle. Now we're gonna rotate the arm backwards, bend the wrist backwards, bring the arm all the way back, bring the head other side, and bring the shoulder up. Okay, here we go. 1, down, 2, down, 3, down, 4, down, 5, down, 6, down, 7, down, 8, down, 9, down, 10, down. Okay, last set for the shoulder shrug. Rotate the arm outwards, bend the wrist backwards, arm backwards, head away. Okay, here we go. Shoulder up. 1, down. 2, down. 3, down. 4, down. 5, down. 6, down. 7, down. 8, down. 9, down. 10, down. Now we're going to do a wrist nerve stretch, same position as the shoulder shrug. We're going to rotate the arm backwards, bend the wrist backwards all the way, bring the arm backwards, head away from the shoulder. Now this time instead of the shoulder, we're going to actually bend the wrist. Bend, 1, bend, 2, bend, 3, bend, 4, bend, 5, bend, 6, bend, 7, bend, 8, bend, 9, bend, 10. The wrist stretch for the nerve at a different angle. We're going to rotate the arm all the way back, bend the wrist backwards, bring the arm all the way back. Shoulder's gonna be away, the head is gonna be away from the shoulder. Okay, here we go. Bend, 1, bend, 2, bend, 3, bend, 4, bend, 5, bend, 6, bend, 7, bend, 8, bend, 9, bend, 10. Last set for the nerve stretch for the wrist. Rotate the arm backwards, bend the wrist backwards, bring the arm back, head away from the shoulder. Here we go. Bend, 1, bend, 2, bend, 3, bend, 4, bend, 5, bend, 6, bend, 7, bend, 8, bend, 9, bend, 10.
I hope these stretches are helpful for you in maintaining your carpal tunnel syndrome symptoms. But if your carpal tunnel syndrome condition is very severe and you require professional treatment, we might be able to help you. we take a holistic approach in treating the carpal tunnel syndrome. Now, what that means is that we make sure there's no neck or shoulder or arm issues that could be contributing to your carpal tunnel syndrome. We make sure the carpal bones that make up the wrist and the carpal tunnel themselves are freely moving to make sure that there's no buildup of pressure inside the carpal tunnel. We also offer advanced treatments such as super pulse laser therapy, which energizes the nerve cells to heal themselves, radio shockwave therapy, which actually reduces spasm in the forearm and the trigger points in the back of the arms to make sure there is no nerve being compressed before the nerve reaches the carpal tunnel. And something like even shockwave therapy, which is the latest and the greatest therapy available in the United States as far as non-invasive therapy is concerned, which dramatically reduces inflammation and increases blood flow. Now, with the right therapy, a lot of times you can avoid injection or surgery and lead a normal, happy, and healthy life. This is Dr. Ma. I hope you feel better soon and have a great day.